A lot of people accept aches and pains as really part of getting older, right? But right now, there's a new way to think about this, to determine your new normal. There may be ways to diagnose and treat it, often without surgery, an alternative to the shots as well. So joining us this morning to talk about this really important and common problem is Dr. Roubion with Metairie Orthopedics and Sports Medicine. Thank you, Doc, for being here. A lot of times you see people go in with excruciating pain and they have no choice in their mind than to get a cortisone shot.
That's right.
Talk about this alternative therapy that you hope becomes more accessible.
So first of all, we love cortisone shots. We like to target it. We like to get into the joint, make patients feel better. Unfortunately, a lot of patients after 3 months or so, they're coming back with pain. And so we meet a lot of patients who have done several rounds of cortisone shots, have done physical therapy, who are not interested in surgery for a variety of reasons, or maybe they're not a great surgical candidate. We do have some other options available, and notably, what we're doing in our clinic, and you might see this popping up in some other clinics, is something called shockwave therapy. And the shockwave therapy is something that can get deep into the tissue. It brings a mechanical wave through the tissue to clear inflammation, and after about 3 or 4 weeks, it can recruit a new blood supply to the area. So a lot of patients are feeling better quickly.
So when you say it recruits new blood supply to the area, what does that do to create some sort of permanent healing, or is it just temporary relief?
You're exactly right. So the first several sessions are generally temporary relief only because it cleared the inflammation. After the new blood supply comes in, your own body can clear that inflammation. Your own body can help rejuvenate that tissue that has maybe had a poor blood supply for many years. Perfect example are some of our tendons in our elbow or in our shoulder who just don't have a great blood supply, and over years they can degenerate to some degree. So this new technology, if you get enough treatments, it can actually start to reverse or at least hold off some of these degenerative changes.
So you guys out there may know what a TENS unit is, right? Electric shockwave therapy. In that way, you were telling me, Doc, in the green room that this is much better than the TENS machine. How so?
It's a little different. So the new technology can actually penetrate deep. So whereas in the old machines in the past, we could target something like plantar fasciitis or Achilles tendons that are right under the skin, these new technologies can actually get deep into the tissue and target something even like a hip, which is very deep, very thick fascia, thick muscle over the top, and the machines can actually get into that area. So that's been the game changer for us, being able to target deep joints, specific structures that we want to try to reverse.
Do you think this can one day replace the need to get the shots or surgery?
I think it's just complementary to those things.
Okay.
So I think in certain settings, a cortisone shot is great, and you may be one and done, and you might be lucky. It's going to be just an additive modality for us to try to treat your pain. Some patients will do this, some patients will do a bit of a combination. It really depends on your pathology, and that's where getting a specific and a correct diagnosis is very important. And
talk about that correct diagnosis.
Yeah, so as orthopedic surgeons, you know, let's just say somebody has shoulder pain. There are many different structures in the shoulder that could have problems. And so when we can target a very specific structure, we feel like we can have good results. We can ultrasound that structure. We can have a very targeted approach instead of a one-size-fits-all for every patient.
Yeah, don't just Amazon yourself one of these things and do it that way.
ChatGPT.
Actually go to a doctor.
Right.
All right. Thank you, Dr. Roubion, as always.
Thank you so much.